Hello, and welcome to the 2021 Be Well Philly Health Hero Challenge celebration presented by Independence Blue Cross. Thank you for tuning in for this truly exciting moment. This event celebrates people who have been making a difference in the region through improving the health and wellness of their local communities. All of them are striving to make positive changes in their community and make Philadelphia a healthier place. This is a very special year as we are celebrating the program's 10th anniversary. The Health Hero Challenge has awarded over $130,000 to continue to support the missions of nonprofits in the Philadelphia region. Thank you to everyone, past, present, and future, who has been a part of such a life-changing program. We'd like to take a moment to honor our past winners. Take a look. We'd also like to thank our sponsor, Independence Blue Cross, for helping us bring this program to life each and every year. We're thankful to partner with them to cultivate this incredible initiative. And now, a word from Independence Blue Cross's Vice President of Marketing, Koleen Cavanaugh.
For more than 80 years, Independence Blue Cross has been a trusted leader in the greater Philadelphia community. Our mission is to enhance the health and well-being of the people and communities that we serve, and this ties directly to the Health Hero Challenge. The Health Hero Challenge nominees embody our mission perfectly, so having this moment to celebrate and recognize them is an honor, especially on this 10th anniversary of the Health Hero Challenge. The Health Hero Challenge is a celebration of our community, and what better time than now to honor and recognize the greatness in our region. People continue to struggle, and the Health Hero Challenge nominees are right there, extending a hand, giving of themselves, and generally working to make people's lives better. It's both inspiring and heartwarming. Nonprofit organizations are vital to a healthy people. They not only improve quality of life for people, they also provide hope and a reminder that someone cares. By supporting people and organizations in our region, like what we see in these health heroes, we can make a strong, relevant, personal, and positive impact on the people who live here. We are thrilled to have the opportunity to award this year's Be Well Philly Health Hero winner with $15,000 for her charity of choice. This year's nominees have shown an extraordinary commitment to the people in our region, and this additional funding can help them do so much more. We've seen the impact that the award has given our previous winners, and it's amazing the things that they're doing to support their communities. At its core, the Health Hero Challenge is about health and well-being, but it's also about a commitment to helping others with no expectation of a reward. Health heroes are people who raise a hand, who take a step forward, all to make life better for people. The accomplishments of this year's nominees are remarkable. They truly personify the title of Health Hero. From all of us at Independence Blue Cross, congratulations to the Health Hero nominees, the finalists, semi-finalists, and of course, this year's winner. Thank you for everything that you do to make our community thrive.
Thank you, Koleen. Before we share more about this year's finalists, I'd like to take a moment to recognize our 10 semi-finalists. Armenta Washington, Ashley Kulikowski, Daniel Brent, John Breen, Kathleen Brown, Christina Burke, Lynette Medley, Shanina Diana, Tahira Austin Muhammad, Tasneem Suleiman, Here are this year's finalists: Tahira Austin Muhammad, Christina Burke, and Armenta Washington. Before we announce our winner, I'd like to play for you a series of 3 videos that will tell you a little bit more about each finalist's story and mission.
Sickle cell disease is the poster child for stigma, racial health disparities, everything that you can name, we go through it. Complications vary for everyone who has sickle cell disease. Even 2 people who have the same genotype may have different complications. The most common complication that we all can talk about is the pain. Wherever there's red blood cells, wherever there's blood in your body, you can have a really bad, painful episode. When you hear someone describe what pain with living with sickle cell disease can be like, it's like a knife or glass flowing through your veins. A lot of the times going into the ED isn't our best option for care, because sickle cell is often looked at as a Black disease, a disease where people only want opioids. We are drug seekers.
The importance of what Tahira's work and her co-founders are doing is just to change that narrative and to ensure that individuals with sickle cell disease get the appropriate care that they should have, both emergently and just through their routine care.
So Crescent has 3 co-founders. We all live with sickle cell disease. And we had a really good friend and peer who also lived with sickle cell disease, and she passed away due to complications of sickle cell disease. It was time for us to make those changes that we knew needed to be made in our city, and to provide those resources to our community that we needed so badly that weren't provided to us in the form of a community-based organization. And that's what Crescent is here to do, fill in those gaps, fill in those voids, uplift the patient voice, be a support organization for the medical community as well, so that way they can focus on the clinical aspect of sickle cell disease and not a bunch of the social determinants. With $15,000 more, we can add another community health worker, and we could partner with Lincoln, Temple, Einstein, Abington. We will be able to support more people who live in North Philly, who live in Germantown, who live in other parts of the city. So now they know that they can call on Crescent.
My husband, Jim Burke, who is also a chef here in Philadelphia, unfortunately was diagnosed with advanced lung cancer. This is at the height of COVID. It could have been really easy to just go under the covers and never come out and make it dark, but I wanted to create joy. My husband was taking this medicine. It's a ritual that can get arduous emotionally. Everyone kept saying, how can we help? How can we help? Just said, Jim takes this medicine every night. Can you think of him? Can you toast to him? And if you pray, send a prayer out. I had no idea what was going to come back to us. Every day we would get calls and text messages, and people made videos to let us know that they were also in this fight with us. I named it. I just called it TAG for short for Tagrisso, Tag Time Happy Hour. And so I said, I think I really have something here with this Tag Time Happy Hour. And I thought I was going to raise maybe $25,000. And in 2 months, we raised over $100,000. We made that happen by our community, our food and beverage community, our restaurant community. It's hard to just constantly put on a smile and be there to serve others if you never feel paid attention to, looked at, recognized, and served yourself.
The hospitality assistance response to Pennsylvania was started right at the beginning of the pandemic. Now we are focusing on making sure that anybody needs money due to any type of hardship in this industry can apply for a grant and receive that grant quickly.
I feel that Harp is going to be able to restore a little bit of balance. Anybody that applies for these grants, they just need a little help to make some ends meet. I feel that Harp is going to be able to uplift others in our great city.
Hi, my name is Armenta Washington, and I am representing Abramson Cancer Center At Penn Medicine, I come from the Office of Diversity and Community Outreach to address cancer health disparities. African Americans are at greater risk of dying from one of the most preventable diseases. We took our services, a best practice of the American Cancer Society, to the community and do what we call a drive-by flu fit. So the FIT is the fecal immunochemical test that the individual could come to Elon Tabernacle Baptist Church. One of the doctors or nurses will walk up to the car, show them how to use the kit at home, answer any questions that they had, show them what the receptacle looked like and where it could be returned. We found 15 people who had a positive FIT, which meant they needed to be seen for a screening colonoscopy. This work is so important to the community, and we are absolutely saving people's lives.
She's always been a supporter, cheerleading, advocate of our program, Frontline Dads, Inc. Frontline Dads is primarily a social justice advocacy organization that focuses on empowering marginalized communities by mentoring young people, providing reentry support, mutual aid to families and communities impacted by violence, neglect, addiction, unemployment, homelessness, and now the COVID pandemic. We also advocate for criminal justice reform, both at the local level and at the state level.
Ruben goes to the community, he meets people where they are to be able to provide a service to people at their time of need. Regardless of what it is, they figure out a way to get it done. That's why I have chosen Frontline Dads as the organization that I would like to select as my charity.
Around the corner from where I grew up in North Philadelphia, a young man, 13-year-old, was shot and killed. We wanted to get men involved with creating a safe passage in these schools so that we could get these kids home. That's what we would use the money for, to support creating a safe corridor, get young people being put at risk.
I'm glad to have been put in this place at this time, be able to serve. It's just about making a difference in the community.
And now, the moment we've all been waiting for. The winner of this year's challenge will be featured in the January issue of Philadelphia Magazine and will receive a $15,000 donation to their charity from Independence Blue Cross and Philadelphia Magazine. The two runners-up will each receive a $2,500 donation to their charities of choice. Although this year's event is virtual, we decided to try something new and get creative so that we could make this a truly memorable experience for our winner. Check it out. We wanted to surprise Armenta Washington at Penn Medicine with her friends and coworkers. We had a giant check and a big bouquet of balloons that were a little unwieldy. Then we road tripped it with the balloons to Penn Medicine. When we got there, they were ready with confetti cannons to surprise Armenta. And we're so excited that Ruben from Frontline Dads could be there for this very special moment. Seeing the emotion on Armenta's and everyone's faces really drove home how important this program is to the whole community. It was also the very first time we actually surprised a winner at their workplace, which was truly fun and remarkable.
Armenta, congratulations. We are so proud of you.
I'm super proud of my friend of almost 40 years. Her love, particularly for marginalized populations and the Black community, and this is truly monumental for all of us. This is the win for all of us, so
yes,
thank you.
Absolutely.
There were hugs and tears all around, and I really think it was a great day. It may not have been the same in person, but we're so thrilled to have had the chance to surprise Armenta Washington and deliver that news face to face. Be Well Philly and Independence Blue Cross are honored to have the chance to acknowledge these health heroes each year and encourage them to continue to make a difference. If you missed any piece of the event or just want to share with friends and family, it will be available tomorrow on the Be Well Philly Instagram and at the YouTube link below. On behalf of Independence Blue Cross, Philadelphia Magazine, and Be Well Philly, I want to thank everyone who has been a part of this amazing program since 2012, as well as those in and around the Philadelphia area who continue to positively impact their local communities every single day. Again, thank you for tuning in, and we'll see you next year.
you.